The fourth one is laboratory and radiology record. Result of all laboratory test, screening test, pathology reports of any tissue or body fluid and radiological assessment that are required in the hospital documentation. Then patient orders. Any order given to the patient must be documented in the chart. Any order by the doctors should be documented in the chart. This includes orders for medication, treatment, nutritional orders, as well as screening tests, physical or occupational therapy, or radiological imaging. The doctor will write the doctor's order sheet. Any order given to the patient must be documented in the chart. In doctor's order sheet, doctor will write, nurse's record, nurses will write. This includes orders for indication, treatment, nutritional orders, as well as the screening test, physical or occupational therapy, or radiological imaging. Then impression and diagnosis. After examining, after diagnosis, after the history and physical examination, the doctor will write the impression and the diagnosis, the patient chart. Then operative procedures, nursing notes. Documentation for encounters by the nursing staff is required, including nutritional, psychosocial and functional evaluation, patient care administered, medication administration, including dose, method of administration, any restraint or isolation that was deemed to be necessary. These are the nursing notes. Then operative procedure. What is the surgery? What is the cause for surgery? Surgery time, what all precautions, what all tests done for surgery, what all the preparations, anesthetic preparation, then patient preparation, all will include written in the operative procedure. Then patient orders. That way. Then consultations. Sorry. Sixth one is operative procedures. Then seventh one is nursing notes. Then consultations. If patient is referred for consultation, that also will recorded. For super specialty consultation or medical consultation, surgical consultation, doctor will write in the doctor's order. Then discharge information. Reason for the hospitalization, present condition, then medication, follow-up, then what all treatment given to the patient, what all the procedures done in the hospital, all this will written in the discharge informations. Then what are the records and reports of CNO officer? CNO is Chief Nursing Officer. The records and reports of the CNO officer. What all records and reports kept in the CNO officer? Allocation register. Allocation register includes the name and addresses of the all nursing staff. Allocation register includes the name and address of the all nursing staff. Then leave account register. The nurses details about the leave, casual leave, annual leave, or any extra leave, loss of pay, all details will be included in the leave account register. Then deployment register. Deployment register include the CNO will write all the nurses and assign which ward. The CNO write all nurses and which all places all these nurses are allocated. That is deployment register. Then cumulative record, chief nursing office communication book. Then roll call book, evening and night roll call book, morning roll call book and evening roll call book. That is attendance. Then daily report of the hospital, which includes daily reports of the hospital, which includes statistics register, total patient number. Then OPD statistics, number of patients came in the OPD. Then emergency ward statistics, number of patients came in emergency ward. Then labor number of patients in labor room. Then critical or private ward, number of patients in the critical or private ward. Then VIP patient report, number of VIP patient came in the hospital and write in the VIP patient report book. These are the daily report of the hospital, which includes. Then institutional records and reports. What are the institutional records and reports? The types of records usually kept in the College of Nursing may be divided into three categories. The institutional records are divided into three categories: students' records, faculty records, general records, or administrative records. Three categories. The institutional records are divided into three categories: students' record, faculty records, general records, or administrative records. First one is student records. First one is admission record. Student admission record, details about the admissions. Then application form, references, medical reports, school records, and the result of the test carried out at the time of selection. These all included in the student records. Then a record of each student's clinical performance, attendance, clinical performance, clinical behavior, all things, incident reports, what teaching, all this will in the clinical record book. Then progress report, students examinations mark written in the progress report. Then cumulative record, daily and clinical attendance, daily attendance book and clinical attendance book. Then class attendance book, number of days in the students are in the classroom. Then health record about the any diseases, general condition of the student. Then monthly weight, monthly height. Then hospital visits, all this will health record. Then leave record, number of leave taken by the students. Then anecdotal record, these are the students records. Then faculty records, in the personal file of each staff member there should be following items. The personal file of each staff member in the college there should be following items: application form of the faculty, then copy of appointment letter and any subsequent letter showing changes in the status, job description, then certificate showing qualification in nursing, BSc or MSc, then other qualification certificate, any other qualifications, any other degrees, then experience certificates, the faculty is working in other hospital or other nursing school or other places. Then membership in professional societies, holding office in the association, SNA, TNA or other organizations. Then